I'm Antonia and I was part of the Big Data Research Group. My project was investigating the rising C-section rates within the NHS.
And you had quite a big challenge sorting out your data set. Do you want to tell us how you did that?
So the NHS collects monthly data about maternity statistics from all of the trusts across the country, which means that there's a lot of data because there's data for every single hospital in the country, every single month, for every single year since about 2005. And it's all collated onto this lovely, really disorganized Excel table, which I had the pleasure of sourcing through.
And sort of how much data did you have in the end?
I think it was around 6,500 different data points with hospitals with different points within them.
And what did you find out?
So what I was trying to do, I wasn't necessarily trying to find new trends, but I was trying to see if factors which in previous literature, so for example maternal age or ethnicity, if that was affecting the possible rise in C-section trends. And I found that for a lot of the previous trends that have been found, I was able to find those in the data set as well, which was kind of cool.
And you actually spoke to a couple of scientists along the way.
Yes.
How did that steer your research?
So I talked to, I think he was a health economist, and I also talked to a couple of gynecologists. And I mainly wanted to ask them where the best places to find different literature on the subject was, and then also the possible trends that I could be looking for, just to narrow it down, because there's a lot of things that go into affecting C-section trends. So it helped narrow down and focus my research a little bit more.
And what you're planning to do in university, how might this sort of be something that's inspired or taken you in a direction you hadn't expected?
So hopefully I will be doing medicine in September, and a lot of the research that I'd done preparing for interviews and things like that, I'd become very interested in medical anthropology, and especially sort of feminist medical anthropology. So being able to do a more scientific spin on that kind of research was really rewarding. And well, I'm probably going to be writing more papers in the future, but hopefully this is the first of many.
Absolutely. And what did you enjoy then about your project? Because I know there were lots of challenges, but what did you actually enjoy about doing it?
So I don't do computer science or maths at A level, but it was really interesting, like having to use Excel in a much more detailed way and kind of having to learn as I go along. I think that definitely teaches you some good problem solving skills.
Absolutely. And any tips for anyone that's doing big data research going forward?
Start with a data set, not with a question, because I started with a question and then ended up working with NHS data, which was not very fun. But yeah, like there's so much data on the internet, and there's so many things you can pick. So pick something you're interested in, because I think it makes it so much easier to do research on it.
Thank you very much.